Hey, Masters Public Health, Ian Gordon here, teaching Learning Librarian in the Brock Library to give you some tips and tricks, some strategies, access to resources, and how to get help as you move forward with this particular fascinating program as well. Let's begin and show you the Health Sciences Library Research Guide. It has tabs for articles, books, great literature data, how to get other sorts of things. The recording is on this particular page, so you can click on that and come back to the recording at any particular time. 10 resources you should know about. Zotero Bib, not bookmark it. I use it 1,000 times a day to create citations. Zotero, the citation management tool to manage your citations. You should be using that as part of your graduate studies. If not, book a consultation or investigate with colleagues. If I can help, you should have that and use it all the time. Omni in our library to find resources. Borrowing from other libraries to get resources not at Brock, so never pay for anything, whether it's an article, a chapter of a book, reach out, we can access and help you to know how to get it, use it, or borrow it and buy it by the library so that you can use it as well. The Brock Library Health Library Research Guide I've kind of pointed to. I always start every search with Google, Advanced Google, Google Books, and Google Scholar. Most people don't know about Advanced Google, so I'll show you about that. Increasingly, how to tackle or use an AI-native database like Undermine or ChatGPT. These are part of most scholars, researchers, and policymakers' toolkit. You got to use these sorts of things. Think about them. PubMed, the Medline database, which is open and accessible. You need to be certified to know how to use it expertly to find those articles, to be proficient, how to be information literate. We'll talk more about that. At the end, I'll show you how, when, and where to get help. This is the Brock Library homepage where there's Omni, hours, all the sorts of services that you could use. And the research guides are listed there in the bottom right. The research guide for health sciences, I showed you the welcome page, but here's the database tab for how to find articles in scholarly databases. I talk about Web of Science Complete, Embase, Medline. You may use some of these sorts of things, but these are undergraduate tools to find 1 or 2 articles, to find research. For graduate studies, there are many more resources we'll talk about in the future. On this page, there's a link to the MESH medical headings, and there's a link to find news as well. Sometimes that's important. Start every search topic, phrase with ChatGPT. I ask the question, what are the most pressing issues in Canadian public health? It gives me a scaffolding or a template or issues that may be relevant. This helps with wording and terms and phrases and acronyms that are used within health sciences as well, and particularly public health. So think of it as a starting point to help frame your topic or your research question or what you want to do as well. It's free, it's open, and it's easy to use. Advanced Google is here. There's the URL. It's a template. I use the form page. So I look for these words or phrases or all these words. I look for items appearing anywhere in the title sometimes or anywhere on the page. But file type is a real thing. So in the bottom, this is file type, a PDF. Most hospital reports, policy directives, articles, scholarly tools are usually in PDF format. So it helps you just filter other than that out. When you click on advanced search, it puts in this script at the top. You may know this already, and finds things that are maybe of interest. Where serendipity is a research methodology. Oh, that's interesting. That's interesting. Oh, I never thought of that. Look on this page. There's a Canadian website, there's an article, and then there's the Wellesley Institute, a policy paper on this particular topic. It's hard to know how it ranks things and when it searches and does search things, but you can throw in different types of searches here and find things that maybe just help you get to where you need to be as quick as possible. Google Scholar is really a tool. So if you go to our Brock Library, you click on search, and you go to Google Scholar. That's important because when you search Google Scholar, any words or phrases, it brings up this institutional URL where Google has all our holdings. So when you put in a search and you search logic, and phrasing, and truncation, our holdings are on the right-hand side, and they usually work quite well. A Google article also can be used as a citation management tool. So if you have a Gmail account on the right-hand side, you can send things or save these things to my library and keep track of them. So it's like a placeholder for you as well. Some people use that. Increasingly, people are using a number of these databases. So I suggest it's ChatGPT and Google Scholar, but there's other one. So here's the top 5 or 6 or 7. There's about 20 I could use. And as AI slowly takes over the world, these databases do different things. I won't go over that now. They're open. You may have to register for them. They usually don't spam you, but these are increasingly tools or play things beyond advanced Google and ChatGPT to get scholarly resources and information. I just want to show you a couple of them. Subscribe to these and use these all the time. I do. Here's Elicit. So I put in a research question. It writes me a summary, a paragraph in APA formatting. It includes 4 citations that are here as well. So it gives you how it finds these and how it ranks these. It's hard to know, but it's usually pretty good in getting started. Perplexity is a database I use all the time. That puts out a template and kind of gives you a form that it creates based on your research question. And it gives you at least 5, sometimes 10 scholarly resources on the websites. So it's interesting to see what they find as beyond a Google search, an advanced Google search, or using other sources as well. Perplexity. Semantic Scholars, a free open database. It's really exhaustive. It's pretty robust. It has features that aren't in many other databases, including Google Scholar. So results you get are only good as the terms or questions you put in. But it's amazing because it points to open access, it points to journals, and allows you to rank and cite these things as well. Undermine is, I guess, the free scholarly database du jour. Register, you can sign in, it doesn't spam you. Here's the research topic. A bot helped me to manage finding scholarly papers on Canadian Indigenous communities and community or health policies. It gives me a detailed summary, the scaffolds and the types of papers, it ranks and sorts these sorts of things in ways that only take seconds to do. I never would have thought of it this way. It also gives me, though this may be hard to read, an introductory paragraph with indented or inserted citations that it's found that may be appropriate. But more importantly, I like Undermine because it's pretty fast, it's current, it's comprehensive, and it gives you 4 to 20. This one gives me 69 citations that may be relevant and provides links to these as well. And then a commentary of how important the articles are. So it's like Google Scholar on steroids. It's smart and it's pretty fast. It's a good starting point to say, what is out there? I just need these 2 articles. I'm using the words and phrases right before you jump into scholarly databases. So Undermine is really neat. If you click on our library, same thing, and you click on the databases tab under search, it brings up all the databases. We have 383 of them. Wow. Open, scholarly, proprietary databases that you have to use through the Brock proxy access. And they're all listed here in alphabetical order. That's where I go to search a database. But sometimes if you put in a term like Medline and you search, it finds that there's at least 4 databases that have Medline, which is the same database no matter what search engine format it uses that you can use. I use Web of Science Complete. It's robust, it's fast, it's quick, but it's an institutional subscription. PubMed, which I said you need to be certified, same database, no smaller, no more current, no less current, same databases in SciFinder. And you may have used Medline via Ovid or Ovid. And it's a really neat database that teaches undergraduates how to use subject headings and search appropriately as well. They're all equally valid. I use Web of Science Complete because it's quick and easy and it's pretty robust. I'm a PubMed expert. I want to suggest you be certified. Here's a video that I show people that's kind of old. It's 17 minutes and 13 seconds. Well wasted. It'll teach you everything how to use PubMed using their interface. Here's my research question, or my topic, the impact of Indigenous Canadian COVID-related community health policies. So I have to unpack that. I can throw that into one of my Undermine or Perplexity or Semantic Scholar databases, but when you search for scholarly research, which is ultimately what you need to do either as part of your program or afterwards when you're practicing as a health professional, how do you unpack this? Because you have to think like the database you're searching as well. So when you go to the research guides, I look to the political sciences databases. So you can look for health sciences. You can look at other type of databases that suggest other databases beyond the top 3 that you would pick as well. But you have to think like the database. So here's the key concepts. Indigenous, COVID. I'm looking at COVID. Community health. Is it public health, community health? And these are the databases that through my experience or working with a consulting person, and when I search Web of Science Complete, because it includes Medline and Web of Science Core Collection, CINAHL is the nursing database. Since I'm dealing with policy or policies, I actually look at the politics collection database. And Scopus is another database like Web of Science. We don't have it at Brock, but maybe you have access to it at another institution for somebody else. It's a really neat database. I've decided, since I'm dealing with COVID, I don't want to go back prior to 2020. I'm just looking at English things. I'm looking at that from a community health, public health perspective. I'm looking for scholarly peer-reviewed articles as my first shot, though I'm interested in looking at anything. I'm going to use Zotero Bib. I'm going to use Zotero. And I'm going to look at things that are Canadian, are COVID-related. Programming is a word I found out, and the word impact is great. It's not usually a great search term, but the impact, the challenges, the barriers to are excellent keywords that you can use as well. This diagram helps me to think through this. I'm looking for everything on Indigenous, community health, policy or policies, and so you can search for Indigenous policies or community health policies or community health as it relates to Indigenous populations. This helps me to separate because you have to search like the database. Sometimes I go to Word Hippo. I don't know if you do. I use it all the time. It's free and it's open to think of other words. So I look up the word impact. You can put any word and it thinks of other words. English isn't perfect. Is it teenager, adolescent, or high school student? Is it Indigenous? Is it Native? Is it first? There's different words you use. It just helps me think of other words I want to search because the results you get in a scholarly database are only as good as the terms and phrases and acronyms you use. I go to the mesh headings, and hopefully you do as well, for all databases, just not for Medline. And so they have the heading for Indigenous Canadians. It's been used since 2021. It defines it. It includes the subclassifications, words, and also words that they've used, but they're going to use Indigenous Canadians. And it gives you a structure of how this is related within the scaffolding. So Indigenous Canadians are a type of Indians in North America that are a type of American Indian or Alaska Native, or a type of Indigenous people. So it helps you to think of words and phrases. And when you search PubMed, you have to think of whether you're expanding, you're exploding, you're looking for major headings. There's options to use these as well, and including in Web of Science. Is it community health or is it public health? Well, they use the term community health planning, used since 1995. Headings also in categories you can use. And if you look in the top right-hand corner, you can restrict and actually do a search in PubMed here. Click on it and add it. It adds to your search and searches PubMed. So you can use PubMed in different ways. You can use defaults to community health planning and all the subheadings. If you restrict it just to major topics, you can do that. If you just don't want to include mesh headings below this substructure, you can use those as well. So it's an interactive tool. The mesh headings are excellent and important to use, but you can combine that with a PubMed search. COVID. So what is the term? Well, it's a long, lengthy description. Introduced in 2021. There's other ways of looking at this, but they use the word COVID-19 if you're looking for articles, though you can use your own natural language as well. So here I am on Web of Science Complete. I did this on an iterative basis, so I looked for everything on regional or community or public within 2 words either side of the word health, like community health, health of public, or I looked up that mesh heading, community health planning as a phrase. I found 1 million articles. It says COVID, so I did shift 8, asterisk, previous to COVID to get pre-COVID or other words, and after COVID to get COVID-related or COVID-19. It picks up all those variant spellings. Or pandemic, or pandemics, or SARS, or words starting with those keywords. I still got hundreds of thousands of things. I looked up my population. I used my mesh headings for Indigenous or Native or Indian. I put in the phrase First Nation or Nations, Métis or Eskimo, because they aren't usually caught in definitions of Indigenous peoples. So I still got thousands of articles. So I limited them by date, and format, and language. So I went back and I said policies or programming or programmers. Then for this search, I looked up all variants for place. Canada, Canadian, Canada's, Canadien, Ontario, put in all the provinces to see what I got. I got 75 results. The results you get is only good as the term you put in. I could get 175. I could get 1,075. So using a scholarly database, you really have to think of how this works. Is 75 too many, too few? Well, you can analyze them. You can create a report. You can create an alert here, meaning you can look for it every week and it'll tell you what articles that are new. But most importantly, am I getting things that relate to my research question topic that are interesting? Here's the 75, so I go through them and I read the abstracts. You can list them by relevance, by citation counts, by any other variants. There's many ways that you can rank them. But I read the titles and the abstracts and the journals they're from, and I click on them, add them to a marked list, and put them into a parking spot because I want to do maybe 5 or 6 different types of searches. I found a few here. So I went back and I dove back into the deep end. Looked for things, and I looked at systematic scoping rapid or meta-analysis as a phrase, because if I find a systematic evidence-based tool that relates to this that's current, published it as an article, that's really a landmine or just a big bonus. It just helps you find things that you can't find any other way. I found a few. I went back and I did another search. I looked for policy or policies of programming. Found a few articles there. So there's more than one way to search. Here's those citations that I looked at. I clicked on them, added them. You can look at the titles and abstracts, but for every citation you look at within this database, it says on the second one, Exploring Indigenous Traditional Healing Programs in Canada, there's 12 citations that have cited this article since it was published in 2023. That's a lot. So you can click on those and look at those 12. Or you can look at the 82 references that are in this database from this article and browse through those as well. Serendipity is a research methodology going, I didn't think of that. It helps to improve your search strategy. You may find things that may be even more better. There's a citation, all the information you need to know. The DOI, Digital Object Identifier, is a social insurance number for this particular article. I cut and pasted. At the bottom of this citation, it tells you the author's keywords, the information. You can email this author. Categories, classifications, and at the bottom it says it has the mesh headings. So it lists the mesh headings for this particular article. So it's in Medline. So I went to Medline and I put the DOI in here, PubMed, and I brought up the article as it's cited in PubMed. It gives me the author, the title, nothing more than I got before. The abstract lists the keywords, but it does an AI too. No human does this, but it finds similar articles. I found articles that have cited this article, may be different from Web of Science, so it's a way of like finding other sorts of things. But most importantly, this article is described using titles, keywords, and acronyms. These are the mesh terms. 1, 2, 3, 4, 5, 6, 7. There's 8 of them. And they're asterisks being most important, or exploded, or major topic. And so delivery of healthcare. Never thought that would be a subject in Medline. Maybe I should go back and search my research and put in that particular term and see if I find any better, newer, or more. Take the DOI. I usually just go to Google Scholar in the Barack, plug it in. It gives you the holdings that are there as well. But it also clicks on, you can save it to your holdings, cite it. It's cited by 23 people's related articles. It's really neat. It's kind of like a see also sort of thing as well. So it just helps you explore how many articles are right there on this particular research question. Citero Bib, there it is. I put the DOI in here. I'm using APA. There's 10,000 styles here. And the measure of a good citation management tool like Citero Bib is, does it interpret the style APA rules correctly? And does it cover a wide swath of materials, just not articles, but books and chapters and books and pieces and dissertations? And yes, it does. Citero bookmark it today. Then without hesitation, I created a Citero file, a subheading, MPH research. I downloaded all those articles, including the one I'm looking for. The citation's right, so I can create citations. I can add notes. I can add tags. I can indent and put my words and feelings or research measures. Citero really captures your research in all the citations. Then I found the article. Here's a citation from Citero Bib. There's no substitute for reading an article fully. Looking at the methodology, the findings, the conclusions, and how it relates to your research question topic of interest. That was a scoping review, and there's many types of reviews. And an evidence-based practice, which Masters of Public Health students were probably engaged in, there's lots of different review families, systematic, rapid, mixed, and they all serve different purposes. And so sometimes they're called correctly or incorrectly. Finding a current research on your topic, finding a scholarly, evidence-based review on your topic are just really good things to search for. At Brock Library, we have a page dedicated to evidence-based practices. It's under the Research Support tab. And we have a guide. And this guide here helps you to know how to do it, what it's all about, or to be more knowledgeable about the role of evidence synthesis in scholarly research. I also sometimes, for a search for a topic, I try to find news articles. Here's a title of an article: Healthcare for Indigenous Peoples in Canada is falling back. It's time to give us the power back. And where it was published, you can cite it. It's good for quote, a statistic. It adds flavor to a research presentation or article. It adds a different voice. It's not scholarly, but it may add to an introduction or a conclusion. A news article is really good. Ask us to help you find a news article. It's really valuable sometimes. Here's another news article I got. Indigenous healthcare needs major overhaul. It's Canadian. It includes statistics. It's really amazing. So you kind of find out who is this person, what is this research they're quoting. Again, it's a supplementary resource to scholarly peer-reviewed articles, thesis, data, dissertations, and other sorts of policy documents. And I'm just going to show you this. I did this for Nursing 1P01. You can download the Zotero app, so when you write and do your article, like I'm doing this for nursing, you can add a citation that automatically adds that citation from Zotero to your references and puts an in-text citation. So as you're writing your paper, you're using this tool, it creates your references. So when you're done your writing, it has your references. Some people swear by this. Reach out how to download the Zotero app for Word. I use it sometimes, not all the time, but you may find it. If you're not using it, check it out. There's lots of databases, lots of them. Here's all the databases that I would suggest. The green ones are open, meaning you may have to register for them, but they're like PubMed. They serve different purposes. The black ones are proprietary databases, so the Brock Library subscribes to these. As you move through the Brock proxy access, you get to use them on or off campus as much as you'd like. So, boy, wouldn't it be nice if there was one database for everything? Well, there's disciplinary lenses. There's new AI-driven databases. There's more databases. We don't have Scopus here, but we have all these databases listed in our list of databases. So where do I start? How do I search? How do I know when I've found everything or enough? Only you can discern that as well. But we're here to help you move through this process. Going back to the Health Sciences Articles tab, these are the databases we tend to start with. Web of Science Complete is one I try to start with. You may go to another disciplinary lens or LibGuide. Here's the one for nursing, which kind of gives you the same but different databases, so it just helps you to kind of pick and choose. And you can use the database tab that we have. I clicked on political science. And you can click on health or other certs or chemistry. There's 31 databases we've listed in our database guide that relate to political science. Because I'm looking at policy or policies. I may use one of these. But at any time, think like the database. Search each database separately. Be open to using Boolean logic. Use the thesaurus to find the appropriate terms, or word hippo. Define your search. Identify keywords and concepts. Build your search. Pick the database. Search your database separately. Run your search. Run it again. Try different searches just to see what you get. Only you know when you found what you're looking for. And evaluate results. And on the right-hand side, refine your search as necessary. I do that many times. For this particular research topic, it may have taken me an hour to refine my search topic and all the databases. Here's that political collection database. It's so policy, government, regulation. It uses some or different terms. It has its own thesaurus. I found a number of articles I put into a folder on the top right-hand side. I found 20 that I sent to my Zotero account as well. Here's Sinhal, which is the nursing database. I use their thesaurus as well to find other sorts of terms. I found 59 articles here. Some may be in Medline and in the politics collection. There may be unique things here that aren't in other databases. That's why it's good to pick up 1, 2, sometimes up to 5 databases to meet your requirements. Is there anything out there on my particular topic? So Medline is the starting point. Use the mesh headings. Try alternate databases that use Medline. We want you to be PubMed certified now and going forward. It takes a bit of time to do that. Use the mesh headings, use Web of Science Complete, use PubMed, but you can use Ovid as well. It helps you to do things you can't do in other Medline database versions. Just want to conclude with a few resources. So books are really important, especially for public health. WorldCat answers a database for all holdings in our library and all academic libraries around the world. And it answers the question, what's been published in a book or parts of a book that's maybe not in our library that may be appropriate. We don't buy lots of books for public health. We buy some books. So you have to depend on finding resources that may or may not be here and then wondering whether you should get them or not. Here's some samplings of books that I found on Indigenous healthcare. Textbooks, policy books, government publication, other learning materials, introduction to. So these books may or may not be in our library. If not here, check to see if it's at another Ontario library. We can bring it here or maybe digitize a chapter or a reading or a paper from it as well. But if we don't have it, reach out to the library. We can sometimes buy these within 24 hours, upload them in digital format, then email you saying that it's now available for you. Because if you find something important, maybe somebody else will probably find this important as well. Don't limit yourself just to rock holdings. Great literature is a bit things. There's encyclopedias, dictionaries here that are open. Chemicals, theses or dissertations are important. They're kind of a gray literature. They're not books, they're not articles, but for emergent areas of research or specific regional or timely research, they're really important as well. Here's a paper I searched using one of the databases that talks about Indigenous healthcare in Northern Ontario, and it's current. Full text available through this link. Amazing resource, I found. You too may be surprised at how many theses and dissertations are related to your topic as well. It's certainly worth the test. We have data, there's lots of databases. Public Health is famous for finding data, creating data, figuring out where it is. Lots of resources. We have people that are experts in data. Here's a database I use, Figshare. It's open. You don't have to register for it. It helps you to find data within articles and scholarly content by searching the tabs or the descriptions, like under a figure, a table, a graph. This search is like going in the side door as opposed to using the scholarly databases. You'll find things here that you won't find any other way. Figshare is a great resource to find data on a particular topic. Research and writing. Well, sometimes you have to write a capstone project, a thesis, a dissertation, a report. I'm not great at it, but there's lots of resources, and the library can help you with this as well. Here's some books on writing and health sciences. We have these in our library, whether it be a handbook, a guide to, or a specific disciplinary lens. They Say, I Say is a classic book. Refining Your Academic Writing is the book I tell people when they say, what one book should I have or should I use? It's an excellent resource on how to develop an idea, frame an argument, spelling, grammar, all those sorts of things as well. So there's lots of books that we can help you with. And if you jump across something we don't have, let us know. We'll get it for you and for other people as well. Do you use any of these? ChatGPT. So if I was doing a research and I found 20 articles and 10 of them I'm going to use, I take the abstracts and upload them into ChatGPT and ask to do a thematical analysis. What is it? The themes, the emergent. It's a really great tool to do that as well. Lots of people are using these for different purposes, and that's okay as well. But help. I've got all these articles. How do I frame that scaffold this into a scholarly paper, an argument, or doing a presentation, or just have to speak to people about it? We can help you manage, find, identify, and craft using your writing skills. At any time, go to the Brock Library. If it's a book we don't have or part of a book, interlibrary loans will get it for you. More specifically, we don't have all the articles in the world. So if it's not here, just ask for it, filling out the form. Usually they get back to you within 3 to 5 days in digital format that you can keep and save. Different types of citation management tools. We preach the religion of Zotero for a variety of reasons, Zotero Bib. And there's different styles of management tools you can use. And if you're doing systematic and evidence-based research, Covenants is a database we use. Where can I get help as I wrap up? The Brock Library help page, the research guides for health, and other research guides. You can always email the library, someone can back you during the business day. Chat service is really neat. I use this as well. So there's someone increasingly through the term when it gets busier, days, nights, and even on weekends from across Ontario. I do this as a shared resource that will answer a question. This isn't working. How can I find this? Or can you help me get started? It's a chat service that's really well used and well liked. If you haven't used it today, just jump in and try it. Or book a consultation. A lot of people do that as well. If you book a consultation, this screen will come up and my name and other people's names are there. Pick a date and a time that works for you. And the app will ask you, so what do you want to meet? You can say, I want to know how to use Zotero. I'm not finding research. I need to find data. I need a thesis or a dissertation that may be helpful. Or I'm just having trouble getting started. Or the professor said to do this, and I wasn't quite sure what they meant. Can you help me with that? We can meet using Teams. That's okay as well. We can also meet in person as well. Research, scholarship, writing is a team sport. You have facilitators, colleagues, you report to people, you're working on projects, you run ideas by people, but make an academic librarian or the Brock University Library an important part of your team. I've showed you different ways and strategies you can do that. We can help you get started. We can help you finish up. You may never use us, but we're an excellent resource, and we're just happy to help at any particular time. I want you to be information literate. How to identify what is it you're looking for, and how do you frame that? How do you find things? What databases and strategies? How do you think like the databases so that you don't find too much or too little, and you find the essential things? How do you critically evaluate them? We can help you with that you need to develop that soft skill. How to apply them, meaning writing and putting these into a written format, and how to acknowledge things. How to cite and provide limitations, and how to put this into paper as you create something. And how do you put this somewhere so that other people can read it as well? Being information literate is really a skill. So you should be Zotero enabled, PubMed certified, and information literate. Put those on your resume. And so that somebody asks you for a job, what do these mean? You can articulate what these means and how they relate to your practice and your research as well. That's me, teaching a Learning Librarian. Email me at any time. I'll get back to you. Email me using a Brock email address, or if not Brock, or something with Brock in the subject line so it doesn't go straight to my junk mail. But we just love working with people. And such an important program. Thanks to the people that helped make this presentation possible. And thanks for your advisors and your faculty people that promoting this program. Good luck with your practicum and your research and your practice. Reach out. We'd be glad to help you there.